Information from this video is not to dispense medical advice nor prescribe the use of information as a form of treatment for medical problems. Please always consult with your physician or medical team on questions you have.
Hi, my name is Judy Macias Harris. I'm a certified speech-language pathologist and instructor of the kinesiotaping method. In this series, I'll be discussing more about oral cavity health, specifically with bacteria in the mouth. I will also share methods that I have found effective in neutralizing the oral cavity. Again, thank you for taking the time to hear me mention prevention.
Bacteria is a group of living organisms. All living organisms contain cells, and all cells consist of elements. There are many complex elements within ecosystems of the oral cavity. However, I will highlight two important ones, nitric oxide and oxygen. In essence, when both elements are in balance with each other, the environment is mutually beneficial. This is what I call neutral territory. When dental caries increase or oral hygiene deteriorates, such as when we're not feeling well or do not practice recommended oral hygiene regimens, then nitric oxide production in a cell can overproduce. When this happens, the environment is no longer in neutral territory. Nitric oxide overproduction can damage cells that need oxygen. This can lead to increased bacteria and plaque to develop. Plaque is a colony of bacteria that creates a sticky covering on, around, and in between teeth. If not removed, colonies of plaque can do damage. Colonies of plaque can also be inhaled into the lungs on tiny droplets of saliva. As saliva is an ecosystem in itself, increased bacteria can change the condition of the environment from alkaline to more acidic. To me, I see saliva more alkaline as a clear flow. When it's more acidic, to me it presents more like cloudy, discolored water. So how can neutral territory, the balance between nitric oxide and oxygen in the oral cavity, be restored? It can be restored by bringing oxygen back in balance. It's always best to consult with your dental provider on their recommendations for your specific needs. 1. Keeping the oral cavity neutral and bioavailable using oral care products that contain xylitol and/or recaldent. 2. Brushing first, then flossing second. I look for dental tools that are gentle on the enamel and gum line. 3. I've been exploring the uses of waterless methods like low-level light therapy as a method for oral care programming. 4. Improving breathing through the nose versus the mouth. Diligence to oral cavity health affects not just the person we treat, but also how we function as interconnected healthcare providers. Treating oral health as a priority can only improve global health, wellness, and immune system functioning.
I hope you found this information useful. The next series will cover the relationship between breath and the oral cavity. I will also discuss what we can do as interdisciplinary healthcare providers to include oral cavity health as a possible factor to dysfunction. Ever onward.